remedy we spoke was, which was the last remedy? Anacardium. Okay. Any quick questions in anacardium? Anything you would like to ask? Or any small contribution after you have gone back home and if you have read some material medicals? Anything that I have left and you feel we should add it? No? Okay, so no problem. See, anacardium is what we did in the last. Okay, hope you are all settled down. Okay, so I'll start with a fresh remedy, a simple remedy, and hopefully next 40-45 minutes we should be in a situation to complete this particular remedy, a small remedy. And I'll start this remedy with a simple case, and I have used this remedy in 3 or 4 cases in my practice till date. Okay, but I will just share whatever I have seen in practice, and we'll also try to understand this in the theory part. Okay, so if you just focus here. Few years back, there was this patient who had come to me, and he should be somewhere around 25-27 years old, young man, basically an engineer. Okay, and he had a complaint, and what was that complaint is, he is a known asthmatic. Fine. And I also tell you many times, each class I do, your maturity levels will increase. Okay, and I am teaching for a second year student, and when I give you a case, it will have its own limitation, because your knowledge also will be little limited, and every year you keep upgrading. Okay, but nevertheless, for a second year student, assuming this case comes in future, we are talking of future tense, what are the probable questions you are going to ask? Okay, very good. Since when you have asthma? Beautiful question. Okay, and you also ask, when is it more, when is it less? Absolutely right. What we call it as modalities. Because in homeopathy we believe each individual, each remedy is different. So asthma is somebody can be more at some time, and asthma for somebody can be less at some time. It all makes sense for a homeopath. Absolutely right. Any other questions? Huh? Any other associated complaints? So when you have asthma, what else you feel? Okay, do you have nausea? Do you have headache? I mean, it could be anything. What else you feel? Associated symptoms. And every time when you get asthma, what is it that triggers your asthma? Very good. Very apt question. Is it the weather? Is it the stress? Is it anything? Good, absolutely right. What else? How it started? See, this is a known case of, is a known asthmatic, meaning last few years he's been having asthma. So how did it start? 5th standard, 6th standard, 7th standard, okay, but how did it start basically? That is also a very valid question. Good. Anything else apart from that? Progression, okay, progression, very good, beautiful. Okay, now whatever questions as a second year student you have contributed, it all makes sense. I'll quickly jump to another very important area. Okay, what are all the remedies? Okay, very good. Blata orientalis. Okay, good. Arsenicum, antimonium, tar, tuja, kalika. Very good. Nice, all there. Antimonium tar again. No problem. See, like when your teacher asks more, the intelligent student starts repeating the same thing. So this is all what you know, what we know. But if you want more, then antimonium tar dubara, arsenicum dubara. You keep repeating. Any other remedies? Very good. Drosera, stricta, spongia. Now all respiratory remedies are coming up. Very good. Dalkebara, Hepasol. Very good. Yeah, Hepar is there. One more sulf you can think of is natronsul. Natronsul. Okay. There are a lot of remedies. Now the question is, which remedy I gave? Now, what was that situation which helped me differentiate the other remedies that you have told? Is, see, he had a job. He had a job, where he had to stay in sea, and he is disconnected from the land. 6 months he stays in sea, he works, and then next 6 months he comes to the land. Okay, right? So this is the situation. I'll come back to this. This is very important because this is the core. This is what made me me prescribe the remedy that I am going to teach today, and why did I prescribe the remedy and what happened after the remedy is something very, very interesting. Okay? Now we'll come to another very important part. I am diverting a little, and post-lunch session it is required. Right? So at least we divert. You will be, I don't use the word alive, you will be awake. You will be awake. Meaning at least few of you might be thinking, why did yourself introduce the word sea, land? What has that got relevance in this particular case? If you have not started thinking, please think. Okay, now I will come back to it. Yeah, one of your friends quickly says, sir, must be the remedy you are talking is a remedy which is there 6 months in the sea and 6 months this remedy is there in the land. Okay, good. I mean, no issues. Post lunch, if you are thinking this much, I am very happy. Thank you for thinking. And you can always have the excuse that it is post lunch. So don't worry, don't hesitate. We'll come back again. I am taking back to your chemistry class. So what is this? Chlorine, bromine, iodine, and we also missed fluorine here. And there's one more. Total we are 5 now. One more which starts with the A. Okay, no problem. Because even I don't remember that. So these are what we call it as halogens. Halogens. Okay. So today I am introducing you to one important halogen. The remedy that we are going to discuss today is a halogen. Again, don't doubt your chemistry knowledge. My chemistry teacher never told that halogen 6 months they are in sea and 6 months they are on land. Please, with due respect to your chemistry teacher, that is not there. Don't think in those lines. But what I want you to understand is, the remedy we are talking is a halogen, and the halogen that I am going to introduce today is bromium. Bromium is what we are going to discuss. Okay. So we will be talking in detail about the bromium and So bromium, from the basic nice to know factor, the common name of bromium is bromine. Okay, and it's a mineral, and the preparation is solution in distilled water. This is the preparation part and the introductory part. Fine, it's a halogen. Done. Now very important is, where do you see bromium acting? Now what we call it as the sphere of action, and we are also looking at the pathogenesis. Any wild guess where is bromium acting? Okay, very good, good. I am happy. I am happy you are using your common sense. Good, keep it up. So using common sense in a post-grad session is a very good thing. Very good, I am happy. So I will not disappoint you. The first area where you see bromium acting is glands. Glands. It's a glandular remedy. It's a glandular remedy. Okay. So what other remedies come to your mind as a second year student? Silicea, Barretta, calcarea. Any other remedies? Huh? Okay, calcarea. Yeah, no problem. See, when you repeat the remedy again, there are two factors. One, your friend was not loud and clear. Second, you are not concentrating. You are so deep immersed in thinking what the glandular remedies are that you forget to concentrate what your friend is trying to tell. So calcarea, Barretta, Silicea, absolutely right. Any other remedies? Is belladonna done? No. Done? No. That's good. So if it is done, please add belladonna also. Belladonna can also be a glandular remedy. Okay? So when we say glandular, the next question that comes up is, bromium affects which glands? Right? Which are those glands that bromium has an affinity for? So that is the sphere of action, and quickly you will see the list, big list, starting with thyroid. You have submandibular, parotid, testis, ovary and mammary. So these are the glands where you see bromium active. Clear? These are the glands where you see bromium active. Now the next question, which is very important, is what is bromium doing acting on all these glands? So acting on these glands, bromium causes swelling, bromium causes induration. Okay. Inflammation, enlargement, induration. Okay, and the next level will be suppuration. So what you see here, stony hardness, swelling. I have not mentioned about one word. What is the word I have not mentioned here? I have not mentioned about suppuration. Remember, this is the key word of bromium. I will be telling you a little later. Acting on the glands, it causes inflammation, induration. Yeah, and induration is nothing but hardness. And the hardness in bromium is stony hard. Stony hard. Any other remedy is stony hard? Bryonia. Stony hard. Especially what is stony hard in bryonia? Mammary. Mastitis, breast feels stony hard. Okay. Bryonia. Done? You also have better remedies. Somebody will be teaching you another remedy you should not miss is conium. Remember, conium. Okay? This is what all of you started shouting when I said bromium. And let me not disappoint you. Bromium also has a very important action on the respiratory tract. Okay? But again, you can recall a lot of respiratory remedies. What remedies? What are the respiratory remedies you can think of? Yeah, very good. Ask me, Kamal. Spongia, yeah, good. Spongia. Drosera. Yeah, I mean we had a discussion a little bit ago, and if time permits, we'll try to compare. Now, acting on the respiratory tract, what is this remedy capable of doing? It causes asthma. Right? So, predominantly bromium is acting on two areas. One is glands, and the other very important area will be respiratory. Okay, fine. So the third objective, we introduced bromium and we have spoken about the spear fraction and pathogenesis. The next very important thing is we are looking at the ailments from. What are all the causative factors in bromium? Ailments from. So if you just see here, Bangalore also you are seeing that summer is setting in. Ailments from getting overheated. As a second year student, minimum 2 remedies should come to your mind. Bryonia and antimonium chloride. There can be many. That's why I am specifically telling minimum. Maximum could be many. Minimum you should know is bryonia, getting overheated, and anti-crude, rightly said by your friend. Okay? Ailments from getting overheated, ailments from exposure to sun. Probably this is where belladonna can come. Natrum carbon, majority of the natrums. Geranium. Okay? Bryonia, anti-crude, all these remedies can come up. And ailments from not exactly overexertion. I have got a picture specifically taken from Google and which denotes ailments from gymming. Gymnastics, gymming. Ailments from gymming. You will have to wait for a little time and tell you what exactly happens in bromium because of gymming. That is interesting. It will come up a little later. Okay? So 3 ailments you have to remember. 2 sphere of actions are very important for us here. One is glands. One is gland and the second area is respiratory system. Okay, and 3 ailments. Without wasting any time, we will quickly start the characteristic symptoms. So what is PQRS? What is peculiar in bromium is what we are trying to understand. Okay, so what you see here is, we'll come back to the case. What was the case I told you? Asthma of a man aged around 26 or 27. Don't worry about the age, because I also saw this case very, few years back. So I don't exactly remember the age, but there's something very catchy and very interesting. See, when he got a job where he had to go to the sea and he had to stay in the sea, his people in Bangalore, they were very apprehensive. He already has asthma. If he goes to the sea, what will happen? Wheezing might increase, etc., etc. But fortunately, what had happened in this guy is, when he was in sea, wheezing was zero. What is it? When he was in sea, wheezing was zero. When he came back to land, to Mumbai, to Bangalore, when he came back, then wheezing started. So this is what in books it is mentioned as sailor's asthma. See, when I was a student like you way back, I was also worried. I was also shocked, puzzled. What is this? Which sailor will come to my clinic? Telling uncle, give me BROMIUM. Fine? You getting my point? But then how you interpret and how you apply is very important. So what was his observation when he was in the sea? He was an engineer. What is it? Oil. What is it called? Petroleum. Fine. In the sea, they drill and they try to extract oil. He was doing some kind of a job where his job had a requirement that he had to stay in the sea, cut away from the external world for 6 months. He had to stay there. But luckily what was observed is there was no wheezing. And this is what is mentioned in your books very high in a remedy called BROMIUM. Sailor's asthma. People who are in the sea, they will not have wheezing. The moment they come to the shore, the moment they come to the land, they start wheezing. So sailor's asthma is what I want you to remember. So many remedies you know for asthma, but sailor's asthma, it's only BROMIUM. So if you're lucky you get a case, you should not miss this remedy. Second very important thing, what you see here is, again, a small boy who is doing gymming. I told you under ailments from gymming. Now what is the effect, what happens in BROMIUM? If you read Alan's keynote, he says, young boys who after gymming will have enlarged heart. Hypertrophy of heart in young boys who are gymming. I hope I am clear. Hypertrophy of heart. Again, you might be knowing many remedies. Any remedies that you can think of? Hypertrophy of heart. You have it in arnica. You have it in agam. You have it in naja. Lot of heart remedies. But the situation in BROMIUM is, heart was normal. After this guy started gymming, heart has gone into hypertrophy. Second. And third, we know that it is a glandular remedy. Which are the glands that you see BROMIUM acting? Parotid, testicles, ovaries, mammary. And what is it causing? Inflammation. How is the inflammation? Slowly happening. See, the indulation or the process, the pathology in BROMIUM, it will happen very slow. And that's why I specifically asked if belladonna is over. How is it in belladonna? Inflammation which is acute, which is very fast. Sudden inflammations, fast inflammation, acute inflammation. Glands go into inflammation. In BROMIUM it takes time. And a beauty here, if you just see what is being told in books. Can somebody read this? Seldom suppurates. What is the meaning? No suppuration. Gland is inflamed, gland is hard, gland is enlarged. But you don't see suppuration. So last 10 months, I see a node here, I see a swelling here. The parotid swelling or the cervical group or the axillary group, they are only swollen, they are indurated, they are hard like a stone, but they are not going to the next level, that is suppuration. And this is how you differentiate which remedy from BROMIUM? Silicea. In silicea you see suppuration. Here you don't see circulation. That is very important. Okay. So third characteristic and fourth, respiratory. It has got a capacity mainly for the larynx, trachea, and of course your bronchi. So what you have to understand is sensation of coldness. Okay. Cold sensation in larynx on inspiration. Every time a BROMIUM patient is breathing in, he feels a cold sensation in the larynx. That is important. And you have another remedy that you can recall from your first year syllabus. Looking at the image, I am not giving you the symptom, but you should be so accurate. Just looking at the image, you should think of the other remedy. What is it I am trying to show you here? I am trying to show you flare nostrils. Flare nostrils. Fan-like movement of elanacea. Okay, very good. Lycopodium. One more. Antiphtat. Antimonium tartaricum. Fan-like movement of elanacea. Antiphtat. Lycopodium. And of course, BROMIUM. Okay. Again, a kind of condition where BROMIUM can be indicated in women, in girls is there is a condition called as physometra. What is it? A condition called as physometra, where what you see is there will be loud passing of flatus from the vaginal orifice. Okay. So physometra, loud emission of flatus from the vagina. Loud emission of flatus from the vagina. Physometra. And then what do you see here? What do you see here? You see cobweb. It is a reality, the girl has painted her face with a cobweb. In BROMIUM, you will have a sensation of cobweb. The patient might be clearing his face. Okay. Where you might have a feeling that there is cobweb. Sensation, what is sensation? Yeah, very good. What is it? What type of symptom? Good, subjective symptom. So when they are talking about sensation, sir, I feel as if there is a cobweb on my face. They keep clearing their face, they keep wiping their face. Okay, so cobweb sensation is what you have in BROMIUM. Okay, sensation of cobweb, on face. And I am talking to you about the side affinity of BROMIUM, and BROMIUM is predominantly left-sided. BROMIUM is predominantly a left-sided remedy. So moving further, our source books talk very high about BROMIUM when it comes to this. What is your observation? Blue eyes. Okay. So BROMIUM and these remedies, as you know, they are proved abroad. US, Germany, and that's where you see. Assuming you still get in India a blue-eyed guy, fine, and who's got a set of symptoms, then BROMIUM can be indicated. Okay. So what you see here is suited. I am talking to you about the physical constitution of BROMIUM. Suited to people, especially young children, blue-eyed, fair people with thin, white, delicate skin and very light hair and eyebrows. Okay. The other halogen you have is iodine. Iodine generally will have black eye. This blue eye is more of BROMIUM, and black eye, when it is in halogen, it is more of iodine. Okay. So till now what we saw, I will have a quick recall because it is very important to understand the next level in BROMIUM. So till now what did we understand? The remedy we are discussing is BROMIUM. I hope by now the remedy name is clear. And BROMIUM, we also realized from the knowledge of chemistry that it is a halogen. And it predominantly acts on two areas. One was glands and the other area is respiratory. And three elements we saw. What were the three elements? overheating, exposure to sun, and the last thing was gymming. Okay. And then immediately we focus on the characteristic symptoms. And the first characteristic symptom is what? Very good. Sailor's asthma. Asthma mainly seen in sailors. Good. First point. Second? Glands. What was the catch? Glands which do not suppurate. Glands which do not suppurate. Second. And third thing? Hypertrophy of heart. Very good. Hypertrophy of heart, which is as a result of gymming, especially seen in children, young children. Good. Third. Fourth. Fourth sensation in larynx every time is inspiring. Good. Fourth. Fifth. What is it? Yeah. Flaring of Yelanese and that flatus. Physometra. Good. Physometra. And then what else? Cobweb sensation. Good. Cobweb sensation of the face. And we saw the physical appearance. Generally, there are children who have blue eye and light hair. Okay, that's what we saw. Now we will try to apply what we have read till now or what we have understood till now. So, what is it that you see here is one 5-mark question that can come up in your exams is describe the respiratory symptoms of BROMIUM. A 5-mark question. Okay, fine. So, acting on lungs or acting on the respiratory, what you have to realize here or what you have to understand here is BROMIUM has an affinity for upper and lower respiratory tract. Though you don't see much of its action on the nose, books do mention that you have got coryza, cold coryza, acting on the nasal mucous membrane, but I will directly start with the larynx. So it has an affinity for the larynx, first point. And not only the larynx, it can also affect the respiratory tract, causing cough, laryngitis, inflammation, and more important is it can cause asthma. Very important. Difficulty in breathing difficulties and asthma. Okay. So we'll quickly look at the action of BROMIUM on the larynx, our voice box. What exactly it does. Your contribution, what can BROMIUM do acting on the larynx? Okay, inflammation, laryngitis, very good. Yeah, it can cause hoarseness. And what is the cause for hoarseness in BROMIUM? Go back to the elements first. No, there is no cold there. That is very important. Hoarseness from getting overheated. Okay. For example, if you read Dr. Kent, Material Medical, Dr. Kent says must be an anti-food disease or even in BROMIUM. The mother who is very overprotective, in hot sun, she has packed this child with layers of clothing. Okay, what he says is, if a child is brought to your clinic on a sunny day with layers of clothing, okay, and for example, if the child develops fever, etc., he says this is a typical situation of getting overheated. So, hoarseness of voice from exposure to sun, from getting overheated can be a possibility. Laryngitis, inflammation of the larynx, okay. Hoarseness of voice from getting overheated or too much of clothing on a warm day. Now you are in a blazer, 3-suit, 4-piece, etc., and it is very hot. You wear it and then you have some issues after that. You can think of BROMIUM. Okay. So hoarseness one, and this we saw. What did we see here in the characteristic symptom? Sensation of cold on inspiration. Okay, that's one symptom you have here. And croup. C-R-O-U-P. Especially seen in infants, seen in children. When there is inflammation of larynx, trachea and the bronchi. Inflammation of larynx, trachea and the bronchi, where child has obstruction, child will have continuous cough. This put together, we call it as croup. Croup. Okay. So croup something interesting here. Many of the symptoms in BROMIUM, they are better by shaving. Shaving, okay? Fine? And in brackets you can write shaving aggravation is carbon-analysis. For example, if they shave and then they get some symptoms, or some symptoms are there and the intelligent patient has observed, sir, when I shave, all these complaints are increasing. The remedy is carbo-analysis. When he is shaving and he is feeling better, the remedy is BROMIUM. Okay? So, scraping in the larynx, many times we have patients telling, sir, before the cough, I have a bad tickling, scraping in my throat. Okay? So, scraping in the larynx producing cough. We are focusing on the respiratory symptoms, and we just completed the action of BROMIUM on larynx. Okay? And this is where it ended, and we look at the character of cough. So cough, which is spasmodic woofing with rattling of mucus in the larynx. In antiplaque, rattling of mucus in the chest. So why there is rattling of mucus in the chest in antiplaque? So the muscles of the lungs, they go into weakness. They go into a state of paresis. And whatever phlegm is formed, they are not able to bring it out. So they are all there, and that gives us a lot of difficulty in breathing, rattling. In BROMIUM, the rattling is seen mainly in the larynx. Okay? So rattling in larynx, mucus, cough aggravation, talking. And you know the ailment, cough aggravation, hot room, inspiration provokes cough. Whenever they are trying to take in air, it leads to cough. Okay? Dry cough with hoarseness and burning, pain behind the sternum. Okay, there is dry cough, and you also see hoarseness and pain and burning behind the sternum every time when the patient is coughing. You see this. Okay. So it's an affinity for larynx, and then we saw cough. And what is the area that is left here? Last part. What is it under respiratory that we have left? Asthma. Good. Asthma. Or difficulty in breathing. Dyspnea. Asthma. See, by now you know a few points related to asthma in BROMIUM. What is it you have in asthma? Asthma mainly cells. Don't forget this, very important. Asthma, dyspnea cannot inspire deep enough, as if he is breathing through sponge. See, lungs feel that there is no enough air, and he feels that he is breathing through sponge. There is something that is obstructing, and he is not able to take in air. Is what you have in BROMIUM. Okay. Asthma, difficulty getting air into the lungs. Bronchial tubes feels they are filled with smoke. Sir, when I am taking in air, I feel it is not going into my lungs. I feel there is something blocked. I feel this passage is filled with smoke. Is what a BROMIUM patient might tell you. So asthma in cellars, asthma better at sea, very important. And asthma coming to seashore. Okay. Which are the other remedies? Seashore aggravation. Very good. What is it? Natron mute. She quickly corrected. Say, for me natron is important. You can just be very smart and natron. That's enough. Sulfur, neuro, also will decide. When you are in doubt, just confidently say natron and keep quiet. Your teacher will ask next, which natron? Then you can scratch your head. But there are many people who are impatient, like me. The moment you say natron, they are very happy, contented with it. Yeah, very good natron. Rest I will, you don't do. So the remedy is natron mute. Natron mute also has seashore aggravation. Any quick inputs why natron has seashore aggravation? What is it? Salt. Beautiful interpretation. What has salt got to do in seashore? Okay, fine. From sea water we prepare salt. Okay, sun is there everywhere, no? In seashore you don't have a special sun coming up. What's your name? Yeah, I am coming. Sun will not come specially for you. What is it? Many of us go to beach. I am not looking at boys and asking them why you go to beach. But generally, when you have people going to the beach, generally what is that? With what intention you go to beach? Now boys realize why. Now they realize why they go to the beach. Okay, when you go to, we are not looking at that point now. What is very important for us is, see, beach for many of them gives them calmness. See, beach for many, at least for nature. Because many of them are not agreeing, where calmness we don't say calmness in the beach. Fine, agreed. Must be, this remedy was proved way back. Okay, but there was not so much of population way back. Beach was not all that crowded way back. But Netram generally, how much ever crowded it is. See, for Netram, it is better than being here in the urban thing. If they go to the beach, that it's calmness for Netram. And what happens when it is calmness? Netram goes back to his old wound, old injury that has caused to his mind, to her mind. Predominantly it's a female remedy. So what happens now, that calmness, she goes back to the old thing. Unfortunately today is Valentine's Day. but then Netram will go back to the love or disappointment. How did that man ditch me? How did he do this? How did that guy do this to me, etc., etc. And she goes back. So that's why Netram's, seashore aggravates. Because it will take them back to the memory lane. All the bad memories keeps coming up to the surface. So they will not like it. So seashore aggravation is Netram. Because they start brooding, they start dwelling over all the past things, past disappointments that has happened in their life, they start thinking. So BROMIUM also has seashore aggravation, but you don't see so much of mental symptoms in BROMIUM. What problem BROMIUM will have? Sir, wheezing. What problem Netram will have? Netram will not have wheezing. But Netram might be sitting, seeing at the thing and sitting somewhere near the rock and she might be weeping. Right? She is sad, she is lost. Okay? And then involuntarily you must see her weeping. If you are a good observer, don't disturb Netram. जाके मत पूछना क्यों, क्या हुआ, नहीं पूछना. This is what homeopathy teaches you. Netrams don't ask. Pulsatillers don't go without asking. Even if you are a stranger now, first will feel very nice. आपने पूछा मेरे बारे में? Good. देखो ये हो गया मेरे साथ. वो लड़का मेरे को छोड़ दिया, ये लड़की छोड़ दिया. They start weeping more. Pulsatilla wants consolation. Pulsatilla wants consolation. Netram does not need consolation. The moment Netram sees you coming close now, she will be very alert and she will be like as if nothing happened. Fine? She is very alert. Okay. Yeah, our time is up, you should go, yeah, I will go. She will not even give you scope to ask. क्यों रो रहे हो आप? मैं रो रहा था? नहीं, वो कुछ नहीं ऐसे. No, you are on the salt. Your reasons for it, पानी में थोड़ा नमक ज़्यादा था ना, शायद वो आँख में चले गए. It went into my eyes. That's irritating. I am not weeping. That is irritating. Or it's very hot. Must be because of that. You see, the sun rays directly is hitting my lacrimal gland. उसके लिए tears. She might give you answers, but she will never give you a scope. आप पल्सेटिला से नहीं पूछेंगे. आप रो रहे हो नमक, आप रो रहे हो because of धूप नहीं. पल्सेटिला will feel very sad. आपने मेरे से नहीं पूछा, मैं क्यों रो रहा हूँ नहीं पूछा आपने. कितना पत्थर दिल हो. Right? That kind of pulsatilla. Pulsatilla wants that kind of attention. And pulsatilla many times you see, कोई है कि आजू बाजू है तो चलो शुरू करो. इधर देख नहीं अभी नहीं रोने का it will tell its lacrimal glands shut up बंद एक बूंद नहीं निकलना अगर एक निकला ना देख मेरे से कोई बुरा नहीं होगा to whom she is telling she is giving instruction to her lacrimal gland नहीं 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 आना पॉजिटिव ऑर्डर इधर चल माल बन रहे आने निकाल आजा वो क्या समुद्र से जाना है समुद्र से इधर आना है all the waves should come here is what pulsatilla feels so pulsatilla is different network is different bromium is different and this difference is what I want you to understand right and that's why I tell you homeopathy is difficult and that's why every other student who is studying homeopathy cannot become a great homeopath because there's a lot of philosophy that goes behind. It's not easy homeopathy, but trust me, it is fun. You'll have to put in your mind, and your heart into this science, into this beautiful system, and it will take you places. It will 100% take you places, but you'll have to give your 100%. Very important. So we'll come back, asthma coming to seizure and so when a question is asked on respiratory, you are focusing on nose, upper respiratory where there is coryza. Quickly you are looking at the trachea, larynx, bronchi, lungs. Laryngitis, croup, okay, cough, asthma, very important. So we are looking at the glands which we have already discussed. Two areas I have already mentioned you about glands. One is sphere of action and the other area, other heading was characteristic symptoms. Now you tell me which are all the glands you see getting affected in BROMIUM. What glands are? Thyroid gland. And I want your attention to a very specific gland and that is parotid gland. BROMIUM has a special affinity for parotid gland. Parotid gland, thyroid gland, breast. Right? Testes, ovaries, okay, submandibular glands. Now what happens here is it causes inflammation, induration, but what is it you are writing it very bold? Seldom, hardly, seldom is rarely, hardly, seldom suppurates. What did they write in Cilicia? Tendency for suppuration. Itna laga. देखो कल सुबह फर्स्ट fine tendency for suppuration is more prominent in Cilicia. So we'll go ahead and we'll also see that this is what we discussed. Swelling and induration of the left testis. We realize that BROMIUM is a left-sided remedy. Enlargement of thyroid in children with light hair, blue eyes and fair skin. And this is what we saw, very important. And even the goiter will be very hard. This I mentioned to you here, stony hard. So the goiter, the testis, the parotid, any gland can be stony hard in BROMIUM. Okay. Now the last area will be the female. Now what do you see in female? Try to interpret now. Affinity for ovaries, which ovary? Very good, left ovary, good, 1 point there. Stony hardness of the, we cannot make out just from pressing, but anyway, it is indurated, it is hard. Very good, correct, very good, beautiful, correct. Why are you hesitating? Absolutely right, that's what I expected. Physometra. Because so many remedies we have spoken. Did every teacher in every remedy female that told physometra? No. It's only BROMIUM that we are talking about. At least the first remedy. Is lycopodium done? Yeah, in lycopodium we have. You also have it in BROMIUM. Physometra, menstrual irregularities, tumor in the breast. We have talked about that. Tumor with stitching pain, aggravation left side, pain from breast to axilla. Pain from breast to axilla, again left side. So left-sided memory, tumor, breast cancer, okay, breast cancer. So the last area here is modalities. What aggravates? Getting overheated, sun, working in the gym, okay, gymming, lying on left side, rest, warm room, night, until midnight, evening. These are the aggravating factors. And amelioration is motion, exercise, simple exercise, and being in sea, being at sea. And coming to the shore, you can also add here near shore. Coming to the shore aggravates. Being at sea ameliorates. Being at sea ameliorates. Okay. Now one last case which I had recently seen, where I had prescribed bromium. I will be sharing that case. And coincidentally, this case will also answer one of your friend's question. See, a friend had a question in private and she was asking me, sir, you said in anacardium that they're very cruel, they're very inhuman and all. Assuming you give anacardium to the patient, what change do you expect? Very valid question by a second year student. I appreciate the question she asked. Sir, will only the particular symptoms go, or will there be a change in the mind as well? Is the question she was asking. Now what is the answer? What is it that I should be trying to tell your fellow friend? What is it? Huh? What is it? Okay, one of your friend is talking of tendency. Meaning what? Can you elaborate? Okay. Okay, yeah, good. See, again, I am happy that a second year boy, student is trying to tell you, sir, the tendency might come down. Okay, good, I appreciate it.
Only particulars.
Huh?
Only particulars.
Okay, one more friend counters him telling, sir, only particulars will go. Mind, hands up. We are not doing anything to do. Anything to mind. Huh?
Composition will not change.
Okay, fine, yeah. How is it? See, many times these things are inbuilt. They are genetic. Process of this development. Okay. So what is the answer for all this is a simple case. We had a case of a girl aged around 25 years and her we were treating for urticaria. Unfortunately, she is with us for last 6-7 months. None of the remedies help, and when the remedies don't help, I generally retake the case. Where did I go wrong? What mistake I made? Why she is not improving? And recently, in one of those retakes, she was trying to tell that she is afraid of ghost. She is afraid of ghost. Especially when it is dark now, she has got bad fear of ghost. Fear of ghost in dark is what she was trying to highlight. Okay? And she cannot sleep alone. 25 years old girl, software engineer, she wants her mother to sleep with her always. Especially in dark, she has issues. I was just checking in the, your repertory. Fear of ghost in dark is what she was trying to tell. And that same thing I was just searching, ghost, dark. And surprisingly, only single remedy pops in, and that single remedy is bromium. What is it? That single remedy is bromium. Now coming back to your question. So will only urticaria go, or will fear of ghost go? Is very important. Right? So, keeping whatever inputs you have given, follow up after 3 months. The same girl, maybe when she came for the follow-up, I was asking, urticaria is much better, it's almost gone. And what was more curious for me as a teacher is I was worried, what happened to the ghost? मतलब जो डर था ना आपको, मतलब देवा अंदर भय इतना ये नहीं तो. Mother immediately said, sir, she is absolutely fine now. I no more sleep next to her. I have freedom to sleep in my room. Right? And that girl also quickly added, sir, now I have no fear of dark. I've got no fear of ghost. Especially in dark, what was that fear is? Ghost. So now she can go to the dark, she can go to the loo at night also if she wants, and mother is free. Fine? So this is very important. So if your remedy is right, and if you are prescribing on the mind and the body, it does wonders. I will also stick to one point he has told. For example, if you give anacardium patient anacardium, then don't expect after your remedy he will become saint. Right? Sir, my husband, I don't know what you did, sir. What you did, I don't know. He has become very quiet. See, rightly said, that intensity, fine? Like, I gave you the example of pouring hot tea. Okay, see, that realization might come. सर अभी भी लगता है गुस्सा आ रहा है, लेकिन आपके दवाई का बाद टी कब से मुंह तक नहीं गया, मेरा मुंह के अंदर गया, लेकिन मेरे बेटा का ऐसा नहीं डाला मैंने. Right? Must be that realization might come. Okay, so this is what you have to be careful about. You have seen many cases. Anger comes down, jealousy comes down. Many times you start accepting things. Suspiciousness goes. Many husbands are thankful to homeopaths. Sir, before she would not allow me to go out. किसके साथ चक्कर चल रहा है? And today, I mean, after a remedy, whatever, बंदा अच्छा है. Not that we are encouraging him to have chakkar. But what I am trying to tell you is, he's been a very genuine guy, sincere guy, but wife has a doubt. Sir, every 15 days he is going to native, sir. And before me, somebody told his aunt's daughter, they had some issues, sir. So now I feel that he is going every 15 days, not to see his mother, sir, to see that lady, sir. This is what it has deeply seated. And trust me, you give the remedy, correct remedy. After a month, 1.5 months, so beautifully the lady says, forget about lady, husband says, sir, she is not asking me. मैं जा रहा हूँ, not that I have stopped going. मैं जा रहा हूँ. Fine? I am going, I am meeting my mother, doing my duty as a son to my mother, I am coming back. Luckily my wife is not questioning me, sir. Before your remedy was, I was doing the same, sir. I did not do anything extra. But she would always pester, why? Why so often? Okay, so these are the changes it can bring in. The only system which can bring in changes at the emotional level is this beautiful science, divine science. Okay, hope on this day we will fall in love more with this beautiful system, this beautiful science. Okay, thank you so much. And if you have any questions, quick questions, or BROMIUM, I hope you have got a clarity. Predominantly glandular and predominantly respiratory. This is what you need to understand. And when you give a homeopathic remedy, fine, considering the mind antibody, first change you should also see is at the level of mind. More important than less important. And you'll positively see changes. Anger, laziness going in, ambition coming up, a lot of changes can happen. But the thing is, what our Hahnemann said, similia similibus curanda. So the remedy should be rightly matched and you have to prescribe. Okay? Any questions?